Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. ABCD2 score. So the ABCD2 score is for identifying the risk and the risk of the TIAs. So it helps in finding the TIAs, and this is determined by the ABCD score. So what are the components of the TIA scoring? So first is we look at the risk factors. Age greater than 60. Greater than or equal to 60, it signifies a score of 1 point. And also there is a SBP. So in terms of SBP, it is greater than 140. So SBP greater than 140 mmHg or DBP greater than 90 mmHg. So all this it leads to a score of 1. Next is the CS. CS stands for the clinical symptoms. Clinical symptoms can include the unilateral weak. So if you are unilaterally weak, and then in terms of speech disturbances. So speech disturbances without the weakness. Speech disturbances without the weakness. So when you look at unilateral weakness, the score here is 2. And then the speech disturbance without weakness, here the score is 1. So the only 2 score we have seen here is in unilateral weakness, there was a 2 points. Now we look at the duration. So in terms of the duration, it is greater than 60 minutes. In terms of greater than 60 minutes, it has a score of 2. Now when you look at 10 to 59 minutes, so 10 to 59 minutes, what is the scoring? The scoring is 1. Now we look at diabetes. So in terms of diabetes, what is the scoring? In terms of diabetes, the score is 1. Now we look at the total score. The total score is to sum up all the scores. So you sum up all the scores, and now we look at the inference of the scores. So in terms of ABCD score is 0. 0 means the 3-month rate of score. So what we are looking at is a 3-month rate of stroke. So under this, the 0 means it will be 0, and for 1 the score it will be 2, for 2 it is going to be 3, for 3 again it will be 3, for 4 it is going to be 8, and then 5 will be 12, 6 will be 17, and lastly 7 is going to be 22. So total score of 7 is going to indicate 3-month rate of stroke to be 22%. To learn and grow daily like this, please do subscribe.